Are you worried about pooping at delivery? Today, I'm going to talk about why it might happen, what the nurses do if you end up pooping at delivery, and I'm also going to give you some tips to avoid pooping at delivery as well. So this is the video for you. And yes, this is information I have gained from my 20 years in labor and delivery. I've seen a lot of people who did and a lot of people who didn't. So I'm here to give you all of the tips. Okay, so why on earth would somebody poop during labor? It probably isn't something you've even thought of until recently. In fact, I feel like a lot of people don't even think of it until they see a social media video. So boo to social media. I don't know. Don't watch those videos because they're not going to be helpful. Today, we're going to give you the real tips. Now, in your body, you have 3 holes, right? At the front, you have your pee hole called your urethra. In the middle, you have your vaginal opening or your birth canal. And then at the back, you have your rectum, which is where the poop comes out. Now, all of this is handled by very large muscles that we call your pelvic floor. They all have their own names, but honestly, I don't know them. But they're very big muscles. So it's not like your pinky where I can move just one finger. It's big muscles that all kind of move together. So you can't really make the choice to push the baby out the middle hole and not make the choice to possibly push something out of the back hole as well. And fun fact, some people, if their bladder isn't empty, do pee while they're pushing as well. So all of those holes can get involved. And yes, I've just made this worse. I'm so sorry. I should have mentioned that. But I just want you to know that really there's no way to pick which area you're pushing out of. And so here is a fun fact. Your nurse, when she sees you pooping at delivery, is actually kind of excited because I know, you're like, what? Because it shows that you're pushing in the right spot. Pushing is really hard because it's something that you do inside of your body. It's not something that is shown on the outside. So while you can have a really screwed up face does not mean that you can be adequately pushing. In fact, a lot of people will push in their face and can burst blood vessels when you got to funnel all that energy. And we even say funnel it out your bottom because that is the way that it needs to go. Now you, if you were just to poop randomly, would be so mortified, right? But in labor and delivery, everything is different. And here's what your nurse is going to do. They have washcloths standing by because this happens in 50 to 75% of births. They are prepared for it. So they have some washcloths standing by, they wipe it, they move on. They may even have air freshener standing by so that no one is the wiser. Now, if your partner starts to look at it or mention it, your nurse is going to give them the evil eye and tell them to shut their mouths about it because again, there's no way to pick which hole you are pushing out of. It all has to come out of the same place. And your nurse is 100% able to take care of this. Honestly, compared to what nurses deal with on a med-surg unit, which is where all of us start in nursing school, the tiny amount of poop that we are dealing with at your delivery is not a big deal to us at all. And in fact, the hospital laundry is set up to manage things on the towels and linens like that beautifully. It's not an uncommon occurrence at the hospital, and it's definitely not an uncommon occurrence for a nurse. It's just part of our job. We're totally used to it, and it is not a big deal. And you're sitting there thinking, how can that not be a big deal, Hillary? And I'm here to tell you, it's just the way nurses are. We put needles inside people's skin. We are present for surgery. If any of that happened outside of the hospital, it would be a big deal. But when it happens in the hospital, we're like, just part of the job. Let's take care of it. And as you become a mom, you're going to find that wiping up poop is actually part of the thing. So very similar to nurses. Now, how can you avoid it? I actually have some tips that you can do to avoid it, or at least to make it less of a big deal. I have a whole video on it. I'm going to link it up above. Tell me down in the comments, is this a concern for you? What are some of the weird worries that you have? I actually have another video on what to do if your water breaks in public that I'll link to down below as well. Thanks for joining us here at The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.